Hi everyone, my name is Masood. I'm going to talk about a genetic study led by Dr. Emily McCann at Macquarie University Center for M&D Research. Please go to the next slide. Amyotrophic lateral sclerosis, or ALS, is the most common form of motor neuron disease. It is a late onset, rapidly progressive disease that is genetically heterogeneous with a poor prognosis. Let's have a look at the third slide, which shows the genetic distribution of ALS. Around 10% of ALS cases are hereditary and classified as familial ALS. Pathogenic variants in ALS-associated gene appears in about 70% of familial and 10% of sporadic cases. Our current understanding of the disease is mainly based on gene discovery. Please look at slide 4. The main objective of this study is to identify a possible correlation between ALS gene mutations and their clinical presentation, specifically the age of disease onset and disease duration. Let's have a look at the method of a study in slide 5. The study reports on the frequency of ALS gene mutation in a large Australian cohort of 1,013 ALS patients recruited between 1990 and 2016. Patients and their family members as the control cohort were recruited from 3 centers in Australia. Genomic DNA was extracted from their blood samples. Please look at the next slide, number 6. The genotype analysis was conducted on the DNA sample using 3 standard methods: repeat primed PCR, sequencing using specific ALS mutation primers, and exome sequencing analysis. Also, patient clinical data were statistically analyzed. The next slide, number 7, shows the result obtained by genotype and phenotype analysis. The study found that about 60% of families carry a known ALS gene mutations. The breakdown of gene mutations in the cohort can be seen in this pie chart figure. C9orf72 gene was the most common cause of familial ALS in the Australian population, with a frequency of more than 40%, followed by SOD1, FUS, and TDP43. The next slide, number 8, demonstrates the result of genotype-phenotype correlation study by the age of disease onset and disease duration. The plot on the left side shows patients with the C9orf72 gene mutations are most likely to develop the disease later in life compared with those with SOD and FUS. This finding may suggest a unique disease mechanism associated with SOD1 and FUS, which is different from the C9orf72 gene mutation. Other gene mutations show no differences in age of onset. However, variation in disease duration was found in Kaplan-Meier survival plot on the right-hand side. In particular, SOD1 and FUS mutation were generally associated with the shorter disease duration. Please go to the next slide, number 9. However, it is important to note that ALS patients often carry multiple gene mutations. So one limitation of this study is that the exome sequencing was not carried out for a relatively large proportion of this cohort. Therefore, they may be potentially carrying other ALS-associated mutation not identified in this study. The study is also limited by the lack of data from the sporadic ALS cases and the availability of clinical data for some samples. Looking at the next slide, number 10, this study is important in 5 major ways. Identifying genotype-phenotype correlation of ALS provides valuable insight into the mechanism of the disease. It can also inform genetic counselors when educating patients on the potential heritability. These findings also assist clinicians in identifying prognostic markers and can be used in future research in developing of more sensitive diagnostic tests and treatment. Thank you for your attention.